colon and rectum. Question and answer session. Welcome to today's podcast, where we discuss the main aspects of surgical management of benign pathologies of the colon and rectum. Our conversation is structured in a question and answer format to support medical students, surgical residents, clinicians, and all listeners interested in the surgical management of benign pathologies of the colon and rectum. Pause the podcast after each question to attempt answer. Let's begin. Pre-operative evaluation. Nutritional and risk assessment. Question: what pre-operative assessment tools are important for predicting post-operative complications and assessing nutritional status? Answer: pre-operative serum albumin and prealbumin levels are important for predicting post-operative complications and assessing nutritional status. Question: why is prealbumin considered a more responsive indicator of nutritional status than albumin? Answer: prealbumin, with its short half-life, provides a more responsive indicator of nutritional status than albumin. Question: are albumin and prealbumin commonly ordered preoperatively? Answer: both albumin and prealbumin are seldom ordered preoperatively and should be considered as part of the preoperative evaluation. Question: what indices are used preoperatively for operative risk prediction? Answer: POSSUM, CR POSSUM, and American College of Surgeons National Surgical Quality Improvement Program calculators are used for operative risk prediction. Question: what inflammatory markers can be beneficial for patients with diverticulitis or inflammatory bowel disease undergoing surgery? Answer: C-reactive protein and procalcitonin can be beneficial for patients with diverticulitis or inflammatory bowel disease. Question: what albumin level is considered a higher surgical risk? Answer: patients with albumin levels below 3 are considered higher risk. Question: can preoperative correction of risk factors improve post-operative outcomes? Answer: preoperative correction of risk factors may improve post-operative outcomes. Question: is body mass index a perfect marker for nutritional assessment? Answer: body mass index is widely used but is an imperfect marker for nutritional assessment. Question: does body mass index differentiate between lean body mass and fat mass? Answer: body mass index does not differentiate between lean body mass and fat mass, which may lead to misclassification of individuals' nutritional status. Question: can body mass index accurately reflect nutritional status in individuals with high muscle mass or muscle wasting? Answer: body mass index may not accurately reflect nutritional status in individuals with high muscle mass or muscle wasting. Question: does body mass index consider fat distribution when assessing surgical risk? Answer: body mass index does not consider fat distribution, which is crucial for assessing surgical risk. Question: does visceral fat increase the risk of surgical complications? Answer: visceral fat, located in the abdominal cavity, increases the risk of surgical complications. Question: how do healthcare providers achieve a comprehensive nutritional assessment before surgery? Answer: healthcare providers use body mass index with other nutritional markers and clinical assessments for a more complete understanding of a patient's nutritional status before surgery. Question: can nutritional supplements rich in arginine benefit surgical patients? Answer: nutritional supplements rich in arginine may boost the immune system and reduce post-operative infectious complications. Question: which patients are considered high risk before surgery? Answer: patients with chronic partial bowel obstruction, cancer, or significant unintentional weight loss are considered high risk. Preoperative bowel preparation. Question: why does colon surgery carry a higher risk of surgical site infection compared to small bowel or upper gastrointestinal tract surgery? Answer: colon surgery carries a higher risk of surgical site infection because of the high bacterial load in human feces. Question: what are key considerations for antibiotic prophylaxis in colon surgery? Answer: key considerations include selecting an antibiotic with the right spectrum of activity, administering it before incision, and discontinuing it after surgery. Question: has the practice of preoperative bowel preparation changed over the past 2 decades? Answer: the practice of preoperative bowel preparation has fluctuated over the past 2 decades. Question: is mechanical bowel preparation alone beneficial before colon resection? Answer: mechanical bowel preparation alone is not beneficial before colon resection. Question: what negative effects can result from preoperative bowel preparation? Answer: bowel preparation can lead to fluid and electrolyte abnormalities, requiring excessive fluid administration during surgery and potentially causing bowel edema and ileus. Question: Is bowel preparation well tolerated by elderly patients and those with multiple medical comorbidities? Answer. Bowel preparation is poorly tolerated by elderly patients and those with multiple medical comorbidities. Question. What combination is used to reduce the risk of surgical site infections and complications in colorectal surgery? Answer. Mechanical bowel preparation and oral antibiotics are used to reduce the risk of surgical site infections and complications. Question. How does mechanical bowel preparation help during surgery? Answer. Mechanical bowel preparation cleanses the colon to decrease bacterial load, minimizing contamination during surgery. Question. What is the role of oral antibiotics in preoperative bowel preparation? Answer. Oral antibiotics target specific bacteria in the colon that could lead to infections. Question. Why is nutritional optimization and infection prevention important before colorectal surgery? Answer. Nutritional optimization and infection prevention strategies are important for improving surgical outcomes in colorectal surgery patients. Question. Should the use of preoperative measures be evaluated for potential benefits and risks? Answer. The use of these measures should be carefully evaluated, considering potential benefits and risks. Question. Are oral antibiotics alone a safe alternative to mechanical bowel preparation for some patients? Answer. Oral antibiotics alone may be a safe alternative to mechanical bowel preparation for patients who cannot tolerate full bowel preparation. Question. Does administering oral antibiotics the day before surgery reduce surgical site infections? Answer. Administering oral antibiotics the day before surgery significantly reduces the occurrence of surgical site infections. Question. Is formal mechanical bowel preparation generally required for patients with inflammatory bowel disease undergoing surgery? Answer. Formal mechanical bowel preparation is generally not required for patients undergoing surgery for inflammatory bowel disease due to their frequent liquid bowel movements. Enhanced recovery protocols. Question. What are enhanced recovery protocols or enhanced recovery after surgery protocols? Answer. Enhanced recovery protocols or enhanced recovery after surgery protocols are evidence-based strategies designed to optimize patient recovery after surgery, including procedures such as colorectal surgery. Question. What are the key elements of enhanced recovery after surgery protocols? Answer. The key elements include preoperative counseling, nutrition such as carbohydrate loading, and the avoidance of mechanical bowel preparation. Question. How is anesthetic management approached in enhanced recovery after surgery protocols? Answer. Anesthetic management involves multimodal analgesia, including regional techniques, and maintaining euvolemia during surgery. Question. What is encouraged during post-surgery recovery under enhanced recovery after surgery protocols? Answer. Early mobilization and oral intake are encouraged to stimulate gut function and enhance patient well-being. Question. Why are drains and nasogastric tubes used sparingly in enhanced recovery after surgery protocols? Answer. Drains and nasogastric tubes are used sparingly because they can cause discomfort and hinder the recovery process. Question. What are the benefits of enhanced recovery after surgery protocols? Answer. Enhanced recovery after surgery protocols reduce hospital stay and post-operative complications without increasing readmission rates. Question. What is required for successful implementation of enhanced recovery after surgery protocols? Answer. Successful implementation requires a multidisciplinary team approach, patient education, staff training, and process redesign. Question. Why is patient adherence important in enhanced recovery after surgery protocols? Answer. Patient adherence is vital for achieving the desired outcomes, and pre-hospitalization education is essential for ensuring compliance. Question. What are the overall benefits of enhanced recovery protocols? Answer. The benefits include reduced morbidity rates, shorter hospital stays, lower healthcare costs, improved patient satisfaction, and decreased mortality rates. Question. In what types of surgery is enhanced recovery protocols applicable and safe? Answer. Enhanced recovery protocols are effective in both laparoscopic and open surgery and are safe for elderly patients. Question. What is necessary for optimal results after implementing enhanced recovery protocols? Answer. Ongoing compliance evaluation and continuous quality improvement are necessary for optimal results with enhanced recovery protocols. Preoperative interventions. Question. Why is preoperative counseling considered essential in enhanced recovery after surgery protocols? Answer. Preoperative counseling is essential for setting expectations, reducing anxiety, and improving compliance with enhanced recovery after surgery protocols. Question: why is optimizing the management of chronic conditions important before surgery? Answer: optimizing chronic conditions such as diabetes, hypertension, and heart disease before surgery is crucial for improving surgical outcomes and minimizing risks. Question: why might some medications need to be adjusted or stopped before surgery? Answer: some medications may need to be adjusted or stopped before surgery to minimize surgical risks and optimize patient safety. Question: what is prehabilitation in the surgical context? Answer: prehabilitation is a new concept aimed at enhancing a patient's functional capacity before surgery, particularly for deconditioned patients or those with multiple comorbidities. Question: what are the components of prehabilitation prior to surgery? Answer: prehabilitation involves physical exercises, nutritional optimization, mental health support, and patient education to reduce post-operative complications and promote efficient recovery. Question: what does the evidence suggest about the benefits of prehabilitation? Answer: studies suggest prehabilitation may improve physical fitness and reduce post-operative complications, but a recent meta-analysis found no reduction in post-operative complication or readmission rates compared to standard care. Pre-admission nutrition and bowel preparation. Question: what is the recommended pre-surgery diet? Answer: a clear liquid diet is recommended up until 2 hours before anesthesia. Question: how strong is the evidence for preoperative carbohydrate loading? Answer: there is weaker evidence supporting ERAS carbohydrate loading before surgery. Question: is mechanical bowel preparation alone beneficial before surgery? Answer: mechanical bowel preparation alone is not beneficial, as shown by strong recommendation based on high-quality evidence. 1a. Question: what is the preferred method of bowel preparation in the United States? Answer: the preferred method is mechanical bowel preparation combined with oral antibiotics. Question: why is mechanical bowel preparation plus oral antibiotics preferred before surgery? Answer: this combination reduces complications, including surgical site infections, especially for left-sided and rectal resections, as recommended by the American Society of Colon and Rectal Surgeons Clinical Practice Guidelines. Strong recommendation based on moderate quality evidence. 1b. Question: does bowel preparation reduce surgical site infections or post-operative morbidity in elective colon resection? Answer: a recent randomized controlled trial found no evidence to support the use of bowel preparation for reducing surgical site infections or post-operative morbidity in elective colon resection. Question: what did most studies on bowel preparation focus on? Answer: the majority of studies focused on patients undergoing colon resections rather than rectal resections. Perioperative interventions. Question: what are enhanced recovery protocols in surgical care? Answer: enhanced recovery protocols are standardized protocols for surgical care that guide perioperative management. Question: how many components do enhanced recovery protocols usually include? Answer: enhanced recovery protocols typically include 20 or more components covering the entire surgical process. Question: what aspects of care do enhanced recovery protocols cover in surgery? Answer: they cover preoperative preparation, intraoperative management, and postoperative care. Question: does the number of steps in enhanced recovery after surgery protocols vary? Answer: yes. The exact number of steps in an enhanced recovery after surgery protocol can vary. Question: what factors influence the number of steps in enhanced recovery after surgery protocols? Answer: the specific protocol, type of surgery, and hospital policies and guidelines can all influence the number of steps. Question: what is the benefit of standardizing enhanced recovery after surgery protocols? Answer: standardization, achieved through collaborative buy-in, helps avoid confusion and promotes timely adherence to care. Question: what is the risk of postoperative surgical site infection in colorectal surgery patients? Answer: patients undergoing colorectal surgery have up to a 20% risk of developing a postoperative surgical site infection. Question: how can surgical site infection rates be reduced in colorectal surgery? Answer: bundles of care, including preoperative chlorhexidine showers, mechanical bowel preparation, and prophylactic antibiotics, can significantly reduce surgical site infection rates. Question: do larger bundles of care provide greater reductions in surgical site infections? Answer. Larger bundles do not necessarily yield greater results, but bundles with a higher proportion of evidence-based interventions show a more substantial impact on surgical site infection prevention. Question. What kind of pain management strategy is recommended in enhanced recovery after surgery protocols? Answer. Multimodal. Opioid-sparing pain management plans are recommended, incorporating acetaminophen, nonsteroidal anti-inflammatory drugs, and gabapentin. Question. What is the effectiveness of transversus abdominis plane block in pain management after surgery? Answer. Transversus abdominis plane block with local anesthetic provides short-term pain relief, reducing opioid need and pain intensity within 24 hours of surgery. Question. When is epidural analgesia generally recommended in surgery? Answer. Epidural analgesia is generally recommended for open surgery but is not commonly used for laparoscopic procedures. Question. What is the advantage of goal-directed fluid therapy during and after surgery? Answer. Goal-directed fluid therapy reduces bowel function recovery time and length of hospital stay. Question. What is the preferred surgical approach in enhanced recovery after surgery protocols? Answer. Minimally invasive surgery is preferred, and routine use of intra-abdominal drains and nasogastric tubes is avoided. Post-operative interventions. Question. How is post-operative pain managed in enhanced recovery after surgery protocols? Answer. Post-operative pain is managed using a multimodal approach to minimize opioid use. Question. What early recovery interventions are recommended after surgery? Answer. Early mobilization and reintroduction of a normal diet within 24 hours are recommended. Question. How can complications such as nausea, vomiting, and ileus be prevented post-operatively? Answer. Proactive management of these complications is essential to ensure patient comfort and facilitate early feeding. Question. What interventions are important in the post-operative period for enhanced recovery after surgery protocols? Answer. Careful fluid management, early catheter removal, deep vein thrombosis prophylaxis, and regular follow-ups are important post-operative interventions. Question. What are the benefits of enhanced recovery after surgery protocols in the post-operative period? Answer. Enhanced recovery after surgery protocols lead to enhanced recovery, reduced complications, and shorter hospital stays. Question. What is required for the successful implementation of enhanced recovery after surgery protocols after surgery? Answer. Buy-in from stakeholders and ongoing monitoring and evaluation are required for successful implementation after surgery. That's it. Thanks for tuning in. If you enjoy our content, please like, share and hit the subscribe button. It's the Everything Surgery Podcast. Dissect the extraordinary.